Now, scientists have lauded the move by the government to sound an alarm of a possible third wave in the country in the month of July. However, as Zainab Mohammed now reports, experts warn that more needs to be done than just early predictions of a possible wave should the country squarely manage another surge in the COVID-19 cases.
After a clear pattern of a surge in COVID-19 cases in the country every 3 months, the Ministry of Health on Wednesday warned of a possible fourth wave come the 4th of July, an announcement that has sparked numerous emotions among experts, with the ongoing crisis in India a clear indication of what might happen should a country be found ill-prepared for a surge in COVID-19 cases. Dr. Misekeli Mbega, a healthcare practitioner and the Deputy Secretary General at KMPDU, says more needs to be done than just early predictions should the country squarely manage another surge in COVID-19 cases. According to Dr. Misekeli, the possibility of another wave scares many health practitioners who are on the front line with very little to be shown a year and a half into the pandemic.
Question that KMPDU keeps on asking for now 1 year going on, that apart from just predicting those waves, what is the government doing about them? 300 million shillings were sent to each county to build ICUs. We all know where that money went to. They have never built those ICUs. They have never hired healthcare workers. They have never even procured the second batch of vaccines to prevent that. And it's very, very frustrating for us healthcare workers. Like, some of us received the first vaccine. We were supposed to get our second vaccination. Nobody has told us whether we'll even get a chance to get those second vaccinations. We all know. Also, the issues around corruption that have bedeviled this whole COVID pandemic. We just hope that July is far enough to enable us as a country to put things in order that will ensure that the fourth wave, no matter how strong it is, saves us.
He further says the existence of many new variants in the country, including the highly lethal Indian strain, could further escalate the coming wave.
Of course, in epidemiology, we expect that as the virus mutates, it becomes more lethal, because then to survive more, maybe adapt to the medication, adapt to the vaccine, so it could be more lethal. But we are optimistic that we'll be able to come out through strongly. Yeah. So as we put the plants in place, the oxygen concentrators in place, we put the ICU beds in place, we have the healthcare workers properly prepared for this, we might be able to get through with it with proper preventive measures.
Meanwhile, the country has today recorded a total of 267 new COVID-19 cases, 57 recoveries and 25 new deaths. Zainab Mohammed, TV47.
Well, Zainab Mohammed